I'm gonna turn it over.
Do you have any questions before we begin? You looked at your equipment?
I already did.
Okay. You're dispatched to the high school track for shortness of breath. It is 74 degrees outside and it is sunny.
Okay, is my scene safe? BSI?
Seat safe and BSI noted.
My nature of illness is shortness of breath. Is this my only patient?
Yes.
I'm gonna go ahead and request ALS, but they're not coming.
They are tied up on the interstate.
Okay. So my general impression is this patient is tripoding. He's having trouble breathing. Hi, my name is Carrie. I'm an EMT. What's going on today, sir?
I can't catch my breath.
Okay, so his airway is open. Breathing is labored. Do I note any audible wheezing?
Yes, you do.
Okay. I'm gonna go ahead and test your pulse. It is strong and bounding at a rate
At 116.
Okay. His skin is warm and dry. When did all this start?
About 15-20 minutes ago.
Did she answer better for you because she was with you? When did all this start, ma'am?
About 15 to 20 minutes ago.
Okay. Did anything make it better or worse?
No, he's just started having difficulty breathing.
Okay. Does he have any medical history like asthma or COPD or?
I think he might have had a history of some lung problems at one point, difficulty
Asthma.
breathing. Asthma.
I have asthma.
Okay, so this is a low to go patient. So we're gonna go ahead and assess your vitals with our equipment with a pulse. Just gonna count your respirations and your pulse, okay? So I got about 90 to 28.
His heart rate is 116 and his respiratory rate is 36.
All right. Does he have an inhaler by any chance?
Yes. It's right here.
All right. Ma'am, while I do this, will you make sure it has his name on it?
Yeah, this is his inhaler. He's used this before. He used it, but it didn't work.
He used it today?
Yeah, it didn't work.
How many times today?
Just one.
You're such a brute. You're doing that on purpose. 138 over 82.
That's correct. That's what it is.
Seriously?
Yeah.
Wow. All right. So we're going to go ahead and get you on some oxygen, 2 liters, nasal cannula, and I'm going to listen to your lung sounds if you don't give it. All right, take a nice deep breath for me. I've got wheezing all around. Is that what you have?
Yes.
Perfect. All right, so we've got him on oxygen. We're going to give him one of his dose inhalers. We're going to assist him as long as it is his end date, the right medicine, the right route. And the other one is right dose. So does that make it any better?
Actually, it does improve with the oxygen and the meter dose inhaler.
Perfect. Are you allergic to anything?
No.
You take any other medicines?
No.
No? What other past medical history? Just the asthma?
Just the asthma.
Okay, when's the last time you ate?
Lunchtime.
Okay, and what were you doing when all this happened?
I was getting ready to race this dude over here, and we were warming up.
How many races have you ran today?
Just 3.
Perfect. Did you win?
12, 2 of them.
Okay. So we're in the ambulance. We're gonna assess his vitals and reassess his lung sounds and all of his assessment, and we're going to transport to the hospital. Done.
Are you done?
Yes.
Done. All right. Anybody mark the time?
It's like 4:30, 4 minutes and 30 seconds.
Okay. All right. Not bad. Not bad. So y'all graded. How do you think you did? She did so. She's been doing it a long time. You'll get there, I promise. So, if anything, tell us. Be constructive. What did she miss?
She didn't say stabilization of spine.
She didn't do C-spine. All right. Not a critical failure, but it is a point. So good noticing that. What else?
Question about that, because this is like a respiratory thing. You just verbalize, like
Just verbalize
we
it.
have no indication
Right.
for C-spine.
And
Okay.
oftentimes, and again, we train like we fight and fight like we train.
Gotcha.
I want to get her, or I want to get you all to talk to your patient. Hey, Dreamer, how you doing today? I'm having some trouble breathing. Well, you didn't fall or anything, did you? Okay, I can rule out C-spine. But you can ask your proctor, do I have any indication of trauma? And they may say no, or they may say, talk to your patient.
So we would say that for anybody.
Yeah,
like any kind of
absolutely.
situation.
Yes, ma'am. What else? So she did circulation. She didn't verbalize. She checked my pulse. She checked my skin color temp. But what part of circulation did she miss?
Major bleeds.
Major bleeds. Again, not a critical failure, but it would have been a point, right? All right. What else? All right. What did she not do in breathing? Lung sounds in breathing. Don't have to, but that's a good assessment tool. You can do that down at the bottom. You can do that in vitals, and she did end up doing that. What else? An assessment that she never did. What didn't you do? You did oxygen.
Saturation.
Oxygen saturation. So had she have done oxygen saturation, we would have said that it was
Initially, it was 94%.
94%, and I'm not picking on you.
No, it's okay. I knew that was coming because I had looked at this, so like that's why I didn't.
Got you.
Because I was already in my noggin.
So we 94% were tripoded and labored. She chose 2 liters, probably okay once you have a little bit of clinical judgment and you've been doing this. That's why she did that, and I'm not saying she's wrong. What I want you all to do is that if you see a patient labored breathing, tripoding, 94%, high flow oxygen. High flow oxygen. We can always drop it back down. We could have brought it back up from the 2 also if it wasn't helping, but we could always bring it back down. Had she have done the oxygen, initially it would have gone to
96%.
96%. Are we good?
Yeah.
Getting better. And then after the inhaler, it would have gone to
99.
99%. What is that inhaler doing? Opening up the airways. Okay? So that was the intervention that she did. Did you notice based on your sheet though, she did the primary assessment, then she made a transport decision. Now, she did ask a few history questions before she made a transport decision, and that's okay. What would not have been okay is if she started asking me the onset before she got through A, B, and C. How long ago did your breathing start? Would have been a failure if she had not done A, B, and C first. Okay? So she did fine. So asking a few of those little questions, that's okay. And then make a transport decision, that's great. But if she just said, well, when did your stuff start? Okay, well, I got a good breathing. That would have been a failure because if you look at your critical failure at the bottom, did any other intervention before ABC? That would have been an intervention, asking another question other than determining a life threat. When you show up to the hospital with a critical patient, delivering a critical patient, those hospital personnel do the exact same thing. You walk into the trauma bay over at RMH, and we're talking about medical here, but you walk into the trauma bay, nobody talks until A, B, and C are stable. Nobody speaks until A, B, and C are done. That's how important that is. Okay, so A, B, and C first. So overall, judging by would you all, being new to this, but looking at your sheet and grading her, would Carrie have passed? Looking at the bottom, the critical failure, did you see any critical failure that she would have gotten?
You won't fail if you say I did a terrible job. Like, it's all good.
No, I think she did a great
I
job.
think she did too.
You did not fail.
No, I'm just saying I don't want them to be
No.
afraid to critique me.
No, please, that's why we do this, because I'm going to critique her. Don't worry.
Oh yeah, I'm super excited about
But
that.
she did not miss any of the critical
No, she
things
did
out
not.
of it.
No.
She just
And
jumped a little.
she jumped a little bit, and that's okay.
Yeah, that's
once
like the
you
natural
get
thing,
past, once you get past A, B, and C, that's okay to jump around. That's okay, as long as you get down to A, B, C first. Did that kind of help you see a medical assessment? Did that help? I know the other night when I was going through all of that, y'all were like, holy crap, that's a lot. But
You'll
did this help
develop
you?
your own way of doing it too.
You will, and you see that. That's how it runs. And it can be done, you see that in 4 minutes. Judging by this, is 10 minutes a long time?
Yes.
10 minutes is a long time, right?
Yeah, and there's like 50 extra eyes on you.
You won't have this when you're testing, I promise.
How many people are in the room when we test?
You, your evaluator, and a patient, and maybe an EMT assist. So at the max, 3 in addition to you. But the people that run the place, that run the test site, can come in at any time.
So
And then-
is it like in a big gym, or is it just like
You're
in
You're in a
You're
classroom.
in, like,
So you'll come into a holding area. Say this is your holding area. And the night that we do our mock registry, this will most likely be your holding area. And you'll come in and there'll be somebody up front and they'll be dispatching. And they'll pick somebody and say, all right, Noah. And when you come up, they'll hand you a card and it'll say trauma 1 or medical 1 or whatever it is. And you'll go and find that room. And when you come back, you bring that card back and you give it to the person. They mark it off that you took it. And then they say, okay, Joanna, now you go. And so now I've got Joanna, Brian, and Dreama at a trauma, a medical, and a random. And then we go until everybody gets a chance to go to all 3 stations.
So the test is 3 stations?
3 stations. You have a medical station, a trauma station, and a random skill that you will pick. We will teach you 6 random skills. Your random skills are, and if you want to write them down, that's fine, but you'll learn them over the time. You've got airway management, bleeding and shock. You have long board, meaning the backboard, long board. You have traction splint. You have joint immobilization and long bone immobilization. And we'll learn about all of those. And what they'll do is they'll take them and they'll set them on a table in a circle. And they'll say, okay, you pick a card, and you pick up a card. It says airway, and you say yes, because that's